Hello and welcome to the Health Me Asia podcast. I'm John Linebaugh and I'm your host. As the name of the podcast implies, we'll be looking at some interesting healthcare services available in Asia and showcase their quality and their value. We're at KDMS Orthopedic Hospital in Bangkok, Thailand. This hospital is one of the newest hospitals in Thailand and specializes in orthopedic surgery and physiotherapy. It also is staffed with some of the best doctors in Thailand, and they're offering world-class healthcare delivery. On this episode, we'll be meeting one of the best spinal surgeons in Thailand. We'll talk about some of his experience and expertise, as well as highlight some of the premier services this hospital offers. Let's meet this rock star. Hi, Dr. Benz. Welcome to the podcast. How are you doing today?
I'm good. Nice to it's my pleasure to have me here today.
Good. I'm really excited you're here because I want to tell a little bit about how we met. It turns out that my wife went to, I guess, the equivalent of high school in Thailand with your wife.
Yeah, that's right.
Yeah. So
same class or something.
Yeah, same class. Your wife obviously went on to be a doctor herself.
Yeah.
My wife went into accounting at the time, I guess, but nonetheless, they stayed connected through Facebook and whatnot, and it presented the opportunity for me to meet you and discuss being a guest on the podcast. I think your reaction when we first met was positive.
Well, very nice to meet you. I mean, I think it was our first time or something that I met your wife too.
But, that's right.
Yeah. With you.
Yeah, that's right.
Yeah, and with my wife too. And so we have a very long conversation.
We did.
Like hour or something.
Right.
Yeah.
You were very interested in the idea, and I didn't really realize at that point about your hospital, which is what we're going to talk about a lot today. So what I want to do is ask you to tell me a little bit about your background, where you went to school, and all the places that you sort of earned your credentials.
Sure. Yeah. So I'm Thai for sure. Yeah, Thai people, and I grew up here in Bangkok, and then I went to the medical school, Chulalongkorn, which is one of the famous one here in Thailand. And then after that, I made my orthopedics board in Thailand as well. And then I work at the Thammasat University Hospital, which is one of the university that it's a teaching hospital, have the medical student, have the resident training. So and then I had the opportunity to go to US to do my fellowship in the spinal surgery, and I spent like 4 years there, 3 in the Western, like California, Orange County, LA, and San Diego. So most of the time, I did the surgery observation, and I did the research part in the labs and, blah, 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 something like that.
During the fellowship?
During the years of fellowship there in the Western, and then I moved to, Connecticut at the Yale University and made the clinical, fellowship year over there, which is a very valuable to me. I can tell you, I learned how to use the, equipment, like microscope, the surgical loops, and then I see lots of cases, with my attendings.
Yeah.
Very nice in the orthopedics spine department. So I'm an orthopedics surgeon.
Right. So during that time, you're viewing, or are you assisting, or are you actually doing some of the surgery? Like, I apologize. Like you're
So I help. I assist most of the time, and sometimes have to do something. If my attendings tell me to to do. So it's a very nice year, and that year I can see varieties of the spinal surgery. from the big things like scoliosis correction, to the very small things like because in that time it's about like 2000 and not from 2007 2010. In that period of time, I spent time in the U.S. So that the beginning of the we call the minimally invasive spinal surgery.
As far as
so that's a good chance for me to see something from there. Yeah, because in that time in Thailand, I think there's none of that. So I saw very good experience there, and then I bring it back here to Thailand and start
like pioneering it. This market.
Yeah, try to because when I see it, I think I talk to myself that this is the way. This is the way. This is the good way to do surgery to the spine.
Right.
You can achieve the same goal what the open surgery want to do, but you don't have to basically you don't have to destroy your for example like back muscle the big skin
through.
Something and you leave lots of scar in the patient's body. So
and also, as you said, minimally invasive, reducing risk of infection and some of those aspects as well. So then tell me a little bit about KDMS and how that project or this hospital came to be.
Okay.
What is KDMS?
All right. So I personally I came back from US and then I work as the like instructor, lecturer or attendings in a university most of the time. Thammasat University Hospital. And then after that, I and my colleagues and also my friends too, not only spine surgeon, but all subspecialty of the orthopedic surgeon, like sport medicines, hands surgery, foot and ankle surgery, something. So we kind of like talk together and then with friends who knows lots of like investor or something, and develop this project together. I be with them from the beginning that they talk we discuss lots of things to set up, for example, to build a hospital for only orthopedics patient, specialized in the orthopedics patient. Like the floor, we talk about like, you should not have any steps on the floor. Because orthopedic surgeons, most of the time, they cannot move like, very easily, like have a back pain, have a knees pain, right, foot and ankle, something like that. So we discuss in every details about this. This is just for example.
It's not just like a typical hospital, as far as
the and
structure.
But I can say the best thing of this hospital is most of the people, I would say, like founders, like that, they are very specialized in their field.
Okay.
For example, and most of them work as the attendings in university hospital. So they kind of like update and for the knowledge, for the surgical skills and the techniques, whatever, and high technology, equipment, something like that.
Latest.
So we make sure that the patients who come and then to get the treatment or the surgery from KDMS hospital, we get the best or almost the best option.
And that's kind of one of the things about this podcast, is to showcase all of the different healthcare in Thailand, for example, but to characterize what comprises that quality. And it's not just the doctors being good, but the equipment being good, the latest equipment, the facility being modern and high tech and well thought out, well planned, as you said, minimal amount of steps, if any. But then also the staff, as far as their delivery of healthcare with quality customer service, and that's Asia, I think, leads the world when it comes to, customer service. And then the final point is that the price for, outside of Thailand is super attractive. So, so how long has KDMS been, you had a opening, you had to be commissioned, I believe, right? Or,
Yeah, I think it's almost 3 years now.
Almost 3 years
probably
now.
like 3 years.
Is there another orthopedic-only hospital?
We're the first one.
Yeah.
I would say, yeah, because this project, in that time before it's happened, so we think about why they have the like eyes,
Yeah.
ophthalmologists,
Yeah.
specialized hospital. They have like ENT,
Yes.
ear, nose, throat. Yeah, something like. Also, they have the skin doctor, lots like that. But
Yeah.
but they don't have the orthopedics, and we think orthopedics things is one of the, I would say, I don't know how to say, it's like a mega trend, because you have elderly patients,
Aging
more
population.
Yeah, aging population, more and more, and most of the orthopedic condition related to the
aging.
right.
It manifests as they live longer.
Yes,
Then they need
like joint degeneration,
Right.
blah blah blah. Yeah. So most of the time we treat the older people.
Right. So the need was there to, with the business plan, to be able to support the business plan or to justify it.
Yeah.
So
Yes.
yeah, good, interesting. So I want to talk a little bit about foreigners who may want to use your facility. For example, somebody in the U.S., may say, my dad has to have a procedure done. He needs spinal surgery. And wait a minute, I see that they have these great doctors, great facilities, and the price is good all the way in Thailand. So can you tell me a little bit about, how KDMS kind of stands out as a specialty hospital in Asia?
Yeah. So that one is it's an aim that we want to grow up and then become one of the best choice for the patients, not only Thai patient,
Right.
but also outside the country as well. We're confident that we have good staff. Not only doctor. I mean, like each kind of specialty surgeon, like shoulder, knees, like myself, the spine surgery.
Yeah.
But also the supporting team.
Physiotherapy.
Right. We have a very good department. We have the rehabilitation doctor. We have the physiotherapist. We have equipment for the patient to do a variety of the
exercise,
the therapy as well. Yeah,
right,
exercise, the pain treatment, muscle relax, something like that.
Right. So then, for spinal surgery, what are some of the, or what are the most common patient, or that present to you? What's the most common type of problem that you see?
Okay, so most common would be one the younger.
Okay.
The younger. The younger patient. The most common things that come to see me and also my colleagues too, I think, is the lumbar disc herniation. Yeah, which is like slip disc.
Okay, that's
and pushing to your nerve, your spinal nerve. So the patient come with a back pain or the buttock pain,
right,
and then radiate down to their legs, something like that.
That's most
common for the younger patient, but for the older, they have the old kind of degeneration of the spine. Like the shifting of the vertebrae. We call the spondylolisthesis.
Okay.
Or the narrowing of the nerve channel, we call the spinal stenosis, something like that. So that's the most common presentation to our hospital.
I want to ask you a little bit about the equipment that you were talking about. Like, what's your favorite tools that you use to do spinal surgery?
Okay. For me, I'm a big fan of the endoscope.
Okay.
I can tell you, I haven't had a chance to see this kind of instruments when I was the fellow in the US. But when I came back here to Thailand and I practiced for some time, and then the trend of the endoscope surgery, have become more and more popular. It started in the time that I'm in the US in that time, but not so, so many people do it. So, but then after that, is again, I would say like popularity very fast, like exponential, go up like this. So, and I love to do the surgery in the minimally invasive way from beginning. I try to learn how to use this, and then adopt it, and then practice it, and then do it more and more until now. So I think it's almost like maybe 10 years or something that I use the scope to assist my surgery. Sometimes I use the scope to do just only the scope, like the condition like slip disc or the disc herniation. So we just do the endoscope, poke the scope inside and then use the instrument and then grab the piece of disc out.
Okay.
Just pushing to the nerve. And that's it.
That's it.
But sometime for now, I do more and more the endoscope assisted spinal fusion.
Yeah, that's interesting. Yeah.
I do the endoscope. I put the like the screw in. Don't have to cut in the open the big wound anymore.
yeah.
We just poke the hole and then put the percutaneous, screw like that, and then do the endoscope to help, to do the spinal decompression, to discectomy, remove all of this out, put the artificial bone in, the spacer, like something like that, and then lock the screw in place. So we use that more and more today, and it's it's give a very good result, promising result.
So help me understand better then, why is that approach or that method, endoscopy, why is it better? Because you have what you can see easier, or just what you can see less invasive wise? Or
I would say that the principle of the endoscope is you make a smaller incision, but you can see it better with the vision when you can see inside, because when you put the scope in, the lens is at the tip of the scope. So it's like you go and then you look at something very close like that.
So you don't need a microscope anymore.
Right. Yeah. The microscope we still use it.
Yeah.
But it's a different cases, you know. But the endoscope, the beautiful thing is we can put inside and we can look at the different angle.
Okay.
And very close to the, the pathology.
Real time.
Right. Yeah. Right. A very delicate surgery.
Yeah.
To be honest. So that's the key success, because the smaller incision but better vision.
And again, it translates to the recovery time of that patient is much faster.
Right. Because it's smaller incision, and then you bypass. You don't have to destroy
muscle
damage.
And other tissue and structures
like
on the way in.
Collateral damage. Yeah. The muscles.
On your approach, you Yeah.
And that's even the big patient.
Okay.
The big patient. If you have the open surgery, you have to even open more
layers
because it's very deep.
Yes.
But for the endoscope, it's more difficult than the thin patient anyway. But it's good because you just bypass the thickness of the skin to the target that you want to do the surgery, and then you can do it underneath it.
Right. You don't have to move stuff.
Right.
To get in.
So that's very, very good indication for that one.
There are a lot of other methods in practice, or several other methods of doing the same thing in practice. Can you give me some examples? Obviously open surgery, but is there other approaches or techniques or technology out there? Robotics, for example. Can you give some?
Oh yeah.
Let me back up and say it this way. What did you do when you first started? how was your approach? And what equipment did you use? Was it open surgery?
Oh yeah, for sure.
Okay.
It's a basic things
Yeah.
that you have to learn, especially when you were the resident, when
Did
you
you have
were
a
the
hammer?
training.
Did you have a hammer?
Yeah, yeah, sure. Yeah, we still use it.
Yeah.
Even with the endoscope surgery, I still have to use the chisel.
Okay.
I still have to use the hammer, like the mallet or
Yeah,
something. So we still use it,
Okay.
but just different way. Yeah. But I would say the open surgery would be the basic thing, which is we still do lots of many conditions that we have
Okay.
to. We still have to do the open surgery. For example, the scoliosis.
Scoliosis.
Yeah, we still have to open it and then do it. For the revision, redo surgery.
Yes.
Somebody had the back surgery, some instrumentation in their back.
And they have some hardware or some implantation.
So that one we have to open, and then we have to remove the old things out, change things,
Wow.
or connect, for longer construction or something like that. So we still have to, the open surgery is not the bad guy.
Okay.
Yeah, it's still we still use it, but for many cases, more and more today, that we can perform in the with the endoscope or in the minimally invasive fashion.
Okay.
So we don't have to open it. That's it.
Yeah.
But still, in some people, some doctors still do it, and they can do it good.
So they prefer to continue.
Right. So,
right. They're more fluent, or they're more confident doing that.
Right.
That way.
Right.
Yeah.
But we just, personally, like myself, I just love to do it in this way.
So then, what's a story or experience, like what your most complicated surgery that you've done, maybe with contrast against something that you did with an endoscope that made it much easier? Do you have any examples of like your most complicated or
complicated
case?
I would say it's happened all the time. I mean the difficult case,
complexity level.
But I think the one that to me that's make my like heart rate going up something is when you do surgery and then just close to the big vessels. Yeah, like that. So because today we perform more and more I would say the anterior construction. I mean the front of the vertebral body.
Wow.
We approach from the front.
Yeah.
So it's basically it's like you go into your tummy.
Yeah.
But you just didn't go into your peritoneum, which is the sac. Which has intestine.
So you have to go around those.
Yeah, we go around to the back part, and then you just find your spine there, and then we do remove the disc from the front, and then put the the bigger cage to support the body like that. And sometimes it's very close to the big vessels.
Yeah.
Yeah.
Wow. So I want to ask a little bit about, for most people, spinal surgery is like, wow, this is a serious, life-threatening almost. It seems super complex. How do you talk to a patient, about the psychology or about accepting that they need surgery? Is
I think the most important thing is you have to tell patient the truth, and let them have a correct expectation, because sometimes it depends on condition. If it's the like straightforward pathology, I can tell people that this is like more than like 80-90% of success rate, something like that. But sometimes in some difficult case, some people have the nerve scar, some people have very difficult anatomy, something like that. So we have to inform the patient, clearly.
Yeah.
Yeah, and tell them what happened to them and what we're gonna do, and how confident I think this is gonna help you. And also, roughly, what the you can expect.
Okay.
The result.
Yeah.
because sometimes we cannot deny that for the nerve surgery, the spinal surgery, you have to involve the nerve, the spinal nerve, something like that. And some people will have that pathology for a long, long time. And also sometimes the nerve condition is not so good at the moment that you do surgery, because they might have the symptom for a long time. So sometimes the nerve recovery it's not like
Not coming back.
it's not like 100% that we hope. Everyone want 100%, but sometimes it's not 100%. So we just have to to tell them the truth and let them have a good expectation. So
Right.
that's gonna be one. And the other one to help me a lot is because the minimally invasive or endoscope surgery.
Yeah.
So because before most of the people will scare when you say, oh, okay, you have to cut your back like this, and then you have to open and then dissect your muscles out, some bleeding, you have to stop it, and then after that you have to stay in the hospital, wait for the drainage. And then sometimes you have to have the
wound
blood
management.
you have the blood transfusion or something like that. But when the change of the practice to endoscope or the minimally invasive things. So most of the people love it. And then, the scary part of them
kind of
decrease a lot.
Right.
Decrease a lot.
And thank you for saying that way, because that is kind of what I was getting at. Most people view spinal surgery as this, we're opening you up entirely, like a turkey at Thanksgiving, right? So good point about we use the endoscopic minimally invasive approach and procedure and reduce the risk of many of those concerns. Okay, so about KDMS Hospital, for a typical procedure that a case that you would have that you would use your endoscopic system. What's a kind of standard package? How many nights in the hospital, and what kind of price range is it for somebody to pay?
Okay, so two things that I said before. For the like slip disc or disc herniation. So that one we just do the endoscope surgery just to remove the piece of the disc out, and we don't have to put any instruments, like titanium instrument or something like that. We don't have to. That one would be a smaller surgery to me. Like maybe patients stay like 1 or 2 nights, and I would say we have the for the standard package, probably about like 10 to 11,000 US, right?
Okay.
But the other thing that's lots of cases too, they need the spinal fusion and instrumentation. For that one, for example, I do the endoscope, assisted, and do the instrumentation for one level or something. The spine surgery depends on how many levels as well. Some people have one level, one motion segment. The motion segment. Yeah. Some people have 2. Some people have more than that problem.
So each one you have to do.
So that's right. And for that one, I would say the basic package for spinal fusion with the endoscope assisted, something like that would be about like 15,000 US something. Right.
How many nights would they stay?
Probably
typically
3
or so.
nights. Yeah.
Okay. Good. So if a foreign customer or patient wanted to use KDMS Hospital, what are some of the services or programs that you guys have to help them, use the facility?
Okay. So we have the international, patient department that they help in, contact with the patient who want to come, not only from outside the country, but also the expat people
already here
inside the country.
Thailand,
and help with the issuing the the paper to help with the visa, something like that, and also about the people who use the insurance. for example, the expat people. So they contact to many insurance already, help them to make it easier to come and then, get service from KDMS.
But you mentioned also that it's not only another continent, just regionally, you have staff that various languages in Asia, correct?
Yeah, I think in last year, from last year to now, we recruit more and more people, like translator to help doctors and the patients communication.
Chinese.
Make sure that there is no right language barrier, and we can provide the best service to any patients.
So then overall, like what are some of the other, we talk about spinal surgery, right? And some of your staff, what are the other big things that KDMS offers?
Things like surgery. We have, advanced technology, for example, robotic assisted total knee replacement or the hip replacement, something like that we can, provide to our patients. And also we try to set up to become, the academy institute, for example, for the nurse, for the doctors who want to come and then see how things flow, like surgery, after surgery service, supporting team, hospital design, something like that, that's specialized for the orthopedic patient, something like that. That the one that we try to be.
I want to ask about some of the equipment you use for endoscopic surgery. Can you tell me some of the names or the brands or some of the things that you specifically, like what machine, do you prefer or that you use?
Okay, that's kind of basic knowledge about the endoscope. I would say the endoscopic spinal surgery.
Yes.
So there's two types of them. One is the we call the uniportal, which is one portal.
Okay.
And the other thing is two portal, or biportal, or in the US they call the dual portal.
Yeah.
Right. I'm the big fan of dual portal. So I use lots of I think the American company, like Smith and Nephew.
Yes, Smith and Nephew.
The CONMED stuff like that. Use the camera, use the cautery.
Yeah, electrosurgery.
Something like that. And
I think that what we are showing here is the value proposition of getting your healthcare in Asia. You get top-notch doctors, surgeons. You get modern facilities that have the latest technology in them. You get fantastic customer service, and then at a price that for the U.S. market and probably most foreign markets is extremely attractive.
Yeah, and not only that, because we try to make ourselves to be the I would say the leader in musculoskeletal hospital. Not only in Thailand, we try to be far more, beyond the country. And also, I think from the country or government, perspective, they try to promote for the Thailand to be like medical hub as well. The people come to Thailand and get the very good treatment, and then maybe they have some, relaxed time to go, because we have many places that they can enjoy, like island, ocean,
yes,
or in waterfall, the forest in the northern part or something.
Yeah. You actually said that better than me, because frankly, that is one of the main reasons I'm doing this podcast, is to help people realize, the quality of what they could get healthcare here in Thailand. And I believe firmly that Asia will be leading the world soon in delivery of healthcare. And so you did my job for me in explaining that to the people in Ghana. That's great. Thank you. So thanks for being on the podcast, Dr. Benz. It's been great having you. Hope we can do another podcast in the future.
You're very welcome.
Being on the show It's a custom-made knife, a Health Me Asia podcast engraved knife.
Okay.
Say thanks for that.
All right. You're welcome. You're very welcome.
Time.